Brow lift surgery, or at least individuals calling to determine their candidacy for brow lift procedures, is a very common call to the office. And brow ptosis, or drooping of the brow, is a very, very common and very underdiagnosed problem when it comes to facial aging. There's many surgeons out there that gravitate immediately towards the upper eyelid complex as the culprit for excess in the upper eyelid, whereas the critical component of how much soft tissue, how much extra skin is sitting on the upper eyelid complex is oftentimes related to where one's general brow position is. As we begin to get older, that brow position begins to droop, begins to sag, and begins to contribute to a lot of that upper eyelid fullness. It closes down the outer aspect of the eye and gives individuals that tired, more aged appearance. Brow lifting has undergone quite a revolution in how we accomplish getting those brows back into a more youthful position. Brow lifting of old involved considerable scarring up in the hairline. It was complete with problems with the inability to feel certain portions of the scalp, with hair loss. So those older procedures have pretty much, and certainly in our practice, have been supplanted or taken over by some of these newer, what we call endoscopic approaches. This is our ability to make very small incisions in the hairline, completely concealed from any onlookers, passing a camera underneath the surface of the brow skin and musculature, and providing the level of elevation after dividing some critical attaching structures, getting the brow into a very much more desirable location. It gives us considerable control over the brow position. We certainly appreciate a lot of individuals' healthy fears about having the brows placed too high in the forehead, giving them the startled deer in the headlight look. What we can now do with these camera-assisted procedures is be very precise as to where we want to put the brow, which aspect of the brow. We do not necessarily have to move the brow in its entirety. And I would say that probably 90% of the time, what we're trying to do is elevate the tail, or the outer aspect of the brow, which is always the larger culprit in providing closure to the upper eyelid complex. So with some of these newer endoscopic procedures, brow lifting really provides a level of refinement to rejuvenation of the eye that we've really never had. So please feel free to give us a call at 727-376-3999 for more information about endoscopic brow lifting.